I'm Kendrick with MyHealth Access Network. I'm a physician. I practice here in Oklahoma, and I'm here to tell you about the exciting opportunities that MyHealth brings to the table for you as you try to choose what health information organization you're going to join. I want to give an overview of MyHealth and the differentiators we view as being a part of MyHealth offering, tell you some about governance, leadership, and participation, and then show you the technology itself. This differentiator, we believe, is MyHealth's extensive offering of services. Any of these I'll show you as we go through the presentation or discuss them in more detail, but we provide direct messaging services. We're included in our basic package, which is a requirement for secure messaging. We provide advanced health analytics to help you with meaningful use reporting, PQRS, as well as participation in numerous payer incentive programs like patient-centered medical home programs, comprehensive primary care initiative, etc., and also patient risk assessment tools. We have feeds with the Oklahoma State Department of Health to help move immunizations in the State Department of Health to avoid that double entry of that data, and also to get data back from the State Department of Health on immunizations that your patients may have received in other places. We provide a patient portal with secure messaging to patients. We also have reference labs we partnered with to do connections and provide lots of lab information in that work. We have an iPhone app, a mobile app for your patients to be able to do their own risk assessments and to refer them back to you when they need additional screening. We have something called the App Cloud, much like the iPhone App Store, which allows the suite of offerings of applications and services that MyHealth brings to the table to always remain fresh and up to date so that the latest innovations can be available to you through MyHealth. And of course, we provide online training and services to make things easier for interactions with us as an organization. We're very focused on helping you get to meaningful use, and here are 16 areas where MyHealth specifically helps you get to meaningful use or augments your existing capabilities to get there. And there's a number here. I won't go into them in detail, but I'll be happy to answer questions about these at the end of the presentation. I think that these are all very important to you, and certainly represents the next level that Meaningful Use Stage 2 is asking us to get to, and MyHealth has been planning for this for quite some time. This is MyHealth's architecture, and each of the clouds on the screen here represent specific capabilities that I'm going to talk to you about today that are part of the MyHealth application. In general, most health information exchanges offer that core system you see there in the middle. It's all of these things around the outside, I think, that differentiate MyHealth within the health information exchange space and offer you something that's more advanced and that will grow as your needs grow in meaningful use and other kinds of reporting capabilities. Another differentiator to MyHealth is cost. As you know, we have to generate revenue somehow, and to support this effort, we consider ourselves a public utility, and as such, we don't, and we're in profit, so we don't need to generate a profit margin. So we charge just what we need to keep the organization sustainable and to ensure that it can deliver the high-quality service that we know you're going to expect. And MyHealth charges a low monthly fee of providers and no initial connectivity fee, and that's an important differentiator. As long as you're able to connect and sign up before September, then we'll be able to apply your connectivity fee part voucher to ongoing monthly service, which, as you can see in the green table here, gives you many months of service beyond this award, which really, I think, helps your pocketbook quite a bit. In addition, we want to create an environment where it actually benefits you to contribute your patient information to the network, because that's how the network grows and thrives. And so we actually provide a discount for those who are connected and sharing data. That's somewhat unique in the health information exchange space, because again, most charge an upfront connection fee, but we want to reward you for having gone through the effort of getting your data included in the network. And then, of course, we have other discount programs depending on maybe specialty societies that you're a part of, or health systems you're participating in, and whatever else might be out there. So our goal is to provide this service at as low a cost as possible, but maintain the quality. And this, we think, is an important differentiator that gets you the service for a long period of time. Another differentiator of MyHealth is that it's easy. It's easy to join. You have to choose MyHealth on your election form, and then sign our participation agreement, which is available on our website. And we have an online training course that you can go through. It's a short 10-15-minute video that you and your staff can watch on your own time. And then my voucher program, My Health team will actually come out to visit you either in person, or you can do it via WebEx like this presentation is being given. And we'll do your voucher attestation and make sure that everybody understands the rules of the road and is able to use the system. And as a web-based system, it's very easy and intuitive to use. And you can begin using My Health for patient care right away. So this is a turnaround time of as little as an hour or two in aggregate, or you can do this over a number of weeks if you'd like. And in the background, then, the MyHealth connectivity team will begin working with your IT folks and your EHR vendor to get connections made. And that's an important thing as well. I'll talk more about it in a moment. Here's a screenshot of our website, and we have online learning guides for specific users like physicians or administrative support, and we also have the video training available online as well. And then back to the establishment of a connection with your practice or your hospital, we can connect we're set to meet you where you are on your technology. So we can connect you using HL7 connections or files and everything in between to get your data moved into the MyHealth environment. And we do have a specific service we offer called Scout, which provides a really lightweight local connectivity option, because we know that most hospitals have tools like Cloverleaf and other things that are specifically set up for connections, but many small practices and even some small hospitals don't have those software tools. Well, rather than having to go out and buy those things, we can provide a tool called Scout that you can install locally in your clinic or in your hospital, and enables the movement of data over a secure HTTPS connection without you having to buy additional hardware or software. That minimizes the cost and the burden on your team. It can take an hour and a half to 2.5 hours to get Scout configured versus 5 weeks sometimes, and even months in some cases to get these larger interfaces configured. So that's a real differentiator to get you guys connected to MyHealth for little pain and little cost. So I always like to sort of center ourselves on why we're talking about information exchange, and one important element to this information exchange, of course, is the improvement of health. I mean, why are we bothering with all of this complicated technology in the first place if there's not some hope that it's going to help us improve health? And you said Oklahoma is ranked near the bottom of the list in health outcomes and health system function. So this is really the challenge we're trying to face together and by providing MyHealth to the community. So MyHealth is, as I mentioned, a nonprofit 501c3 created by a grassroots community-driven effort of more than 100 organizations. Now we're more than 150 groups, and we're governed by our participating community. We're focused on improving health for the benefit of patients, employers, and providers, and as I said, we view ourselves as a healthcare public utility. Here's where MyHealth stood in July of 2012, which was at about 1.5 million patients in the system. If we fast forward to today, or this last month, May, you can see that these patients who are being treated in our communities, the communities that MyHealth serves, come from all over the United States. So we have a very broad spread around the state of Oklahoma, certainly, but as well, we're all taking care of patients that are coming from many places. So this represents about 101 million clinical data elements on 2.4 million patients now in the MyHealth Access Network, and we're at a rate of 300,000 clinical data elements per day. So this is a robust network that is quite valuable in the delivery of health care. And our locations by city to show that we've spread really throughout the state of Oklahoma and continue to grow. Some of our members, we have a lot of the largest players in healthcare participating in MyHealth, including both OU and OSU, the health departments, the Tulsa County Medical Society, the mental health groups, as well as the large health systems and many rural hospitals as well, and several of the tribes as well. So we think that this broad participation sort of has hit a tipping point where we're beginning to get participants on a very frequent basis coming in the door, and this this is important to the growth and health of the organization. So important points, MyHealth doesn't deliver healthcare. You deliver healthcare. We are there simply to help them move from one place to another and to give you tools to work with your own data and information so that you can deliver higher quality care to the patients you serve. Health was chosen as one of the 17 beacon communities, which put us on a pretty high set a high bar for performance. Essentially, the Office of National Coordinator selected us from among more than 140 applications to be among the 17, which also includes the Mayo Clinics and Geisinger. And so MyHealth has a lot of attention nationally on the work that we're doing here in Oklahoma. And it's nice to have Oklahoma being a leader in a healthcare metric. And so our actual proposal for Beacon was singled out not because of the poor health outcomes, which we certainly have in Oklahoma, but because we have innovations baked in. And I'm going to show you those now. These are the things that I reviewed briefly at the beginning under differentiators. But our base framework for health improvement is first to pull together community-wide health data and then provide you, the providers, with some tools to identify and synthesize care opportunities and to use those tools to address those care opportunities. So first is the Health Information Exchange, and you can see this is a web browser-based tool, very easy to access for the appropriate users, but highly secure as well. And when I log in and attest that I am indeed in a treatment relationship with this patient, I'm presented with a comprehensive view of the patient's record, not just the data that's in my own charts in my clinic, but the information from my local hospital, from the lab companies and other places that are a part of the MyHealth network. And so you can see problem lists, labs, medications, allergies, procedures, vital signs. Documents have been a very important addition to the system, so the discharge summaries, H&Ps, consultations, procedure notes, etc., are available in the clinical documents area, and really makes a difference for me, at least, when I see patients post-hospitalization. It really makes a difference to have those records immediately available to me. It also helps those who are doing care management on patients to have a one-stop shop for the patient's records, so that they can help make the best coordination decisions for that patient's health. It shows a typical patient I would see, and the blue box, of course, covers the patient's identifying information and addresses, but this shows that there are, on a typical patient I see, at least 4 or 5 places where they have other records coming from. And the first time I saw this, it really made me think twice about all of the medical decisions I'd been making over the last decade that were without these other 4 sources of information in consideration. And I began to recognize why we have such a high rate of adverse drug events in Oklahoma and such a high rate of doc shopping and ER hopping and so forth. And it's simply because it's difficult to know where else patients are getting care and what other decisions have already been made on their health. I mentioned previously that MyHealth has something called an app cloud, and this is much like the App Store on your iPhone or the Android market on your Android phone, etc. And so surrounding our core health information exchange, that is all the data and the tool I just showed you, we have this app cloud with all these other tools in it. And many of these tools can be leveraged by you, your hospital, or your practice to do additional things in support of patient care, such as care management and coordination tools, care transition management tools, patient portals, and so on. And I'll show you a couple of those. First of all, MyHealth has in its app cloud a direct messaging suite, and so the new requirements in Stage 2 meaningful use for using extensive direct messaging capabilities are built in right here in MyHealth, are baked into the cost of your health license. So you can send secure emails with other providers in the community. We have a provider directory as well, as you can see here. And we also have connections with other health information exchanges so that you can send records and messages securely beyond the Health Access Network to other networks in the community. Also has a connection to Microsoft Health Vault, which is a free patient portal, and enable you to deliver the records that you have to deliver to patients under meaningful use without the overhead and the burden of maintaining your own patient portal and those user accounts and so forth. And so you see here, if I connect a patient to Health Vault, which is as simple as clicking this button, which is something my staff usually does, then the patient's Health Vault account is connected to the MyHealth account, and data can move between them. So this is my own Health Vault account, and within it, I'm able to do secure messaging with my providers or with others in Health Vault. I can also, as a patient, connect my home pressure cuff, which can upload its data. That's about a $40 blood pressure cuff. Can now send blood pressure readings into MyHealth that I, the provider, the physician, can review on their behalf. Also allows the patient to upload weight data, and there are now, you may know, Wi-Fi scales that can be purchased that every time the patient steps on them, it transmits the weight into the system and uploads it into Health Vault, which can then be sent if the patient is connected into the MyHealth system. It also takes data in from things like Fitbits and other activity trackers, which are kind of the new way patients are becoming involved in the management of their own health, which I think we all view as a positive, enabling them to track their activity and their diet and other things, and even this data can flow into Health Vault and up to MyHealth as well. It allows me patients to have proxies for their children or for elderly parents, so that my son's peak flows from his digital peak flow meter can be uploaded to the system, so that should he need to go to the emergency room, his records can be there even home before he arrives in the emergency room. I've just described to you are all of the point-of-care tools that MyHealth provides, so that you can see and interact with those tools as you're managing patients. The next piece of this is about the analytics, and you may notice that programs from Medicare especially, but other payers are beginning to require and request us to provide data on our performance, to provide data on costs and on decisions we make and whether those benefit patients or not. This burden is certainly new to the delivery of health care, because I certainly didn't, and most physicians didn't go to medical school to be epidemiologists, and yet now we're being asked for this reporting and data. And so MyHealth strives to provide tools, analytics tools, that take the burden, the reporting burden, off of the practice or the hospital and help you to meet those reporting requirements with a minimum of pain. And so here's how we do that. So Archimedes has a number of tools in them that help providers plan outreach. You can take the patients in your practice and find out, who's using the emergency room and for what, and how can I redirect them back into my clinic? How can I make sure that my asthma, COPD, and CHF admissions are not going up? These are tools you can run all the time. You can find your patients who are utilizing the emergency room, be alerted when they're in the emergency room so that you can get them redirected into your practice. You can find patients who are in the cholesterol screening or HDL, vitamin A1C screening, or about any other lab test. Depending on your specialty, you may be interested in alpha protein measures or triple screens or many other kinds of metrics. And because of the breadth of data in MyHealth, including all these lab tests and results and all of these vital signs, you'll be able to generate dashboards just for your practice that are tailored to your needs or to your hospital to help you generate the reports you need. For example, 30-day readmissions and where else, maybe other hospitals are admitting your patients within 30 days. These are risks that you certainly need to know about. This is a provider panel from my own practice. I've obviously covered up patient names, but what you see here is I've set it up so that every day I get a report of key measures out of control on my patient panel, and which of those measures are out of control. So I can know which patients I need to focus on in the coming weeks to get scheduled for visits and to do proactive management of their disease rather than just reacting to those patients who decide to come to see me. And this is an important part of improving health. And this report is emailed to me every morning, and it's something that's configurable in the analytics environment. And then I have dashboards that I can follow of health across my whole practice or across my hospital. So just about any report that I've shown you briefly can be put into this dashboard. As you can see, this tool is also a web-based tool that you can interact with and control. some advanced analytics tools. This is something called Archimedes Indigo, which allows me to look at my patient population not just by who has high blood pressure or who has high cholesterol, but what is the patient's overall risk of an outcome like a stroke or a heart attack or cancer. So this basically lets me say, well, Ms. Smith obviously is going to meet the treatment guideline for hypertension, but Ms. Jones would often be missed in many practices. But it turns out that if you use this tool called Indigo, it gives me a new set of vital signs that show me the risk of stroke or heart attack or other things, but it also shows me the opportunity to reduce that risk if I can get the blood pressure under control. So that helps me identify those patients who are going to benefit most from treatment. And in a situation where we're all being asked to enter into more risk-based contracts like accountable care organizations or patient-centered medical homes with performance targets, this kind of tool can be invaluable in helping you to find the right patients to get into more focused treatment. So the way this tool is presented is that when I log into MyHealth, you can see Indigo Risk Scores panel here, and it shows me in a color-coded fashion where the patient's risks fall. And this is based on more than 100 data points from each patient that are used on an almost daily basis, depending on when there are changes in the patient's record. The score will be updated on every patient in the system. And so you can see that if I put my cursor over cardiovascular disease, I'm given the numbers. I can see the 5-year risk of stroke or heart attack and a new potential risk. That is, what risk could I get the patient down to? And then the things that are driving this patient's risk, whether it's cholesterol or high blood pressure, all are shown here, and the treatments that are most likely to reduce that risk. And so this tool allows me, if I have diabetes here, to see what the patient's potential 5-year risk of developing a disease is, but what I could get them down to with adequate counseling and treatment. And so this tool helps me in situations, say an emergency room, an urgent care, or even just an acute patient visit where the patient has come to see me for a cough or a big toe problem. This makes sure that I don't forget to talk to them about these critical issues that are affecting their risk, like their heart disease or their diabetes risk. And so this is a very important element to this. I mean, if I click on this tool, I'm brought into a tool that's used for patient education. And you may know that Stage 2 of Meaningful Use requires patient engagement and shared decision-making. And this tool, baked right into MyHealth, allows that to go on. So here I'm looking at that same patient. I see that a healthy person their age has this low risk in the green, and their risk today is this patient's risk today is the black. But I'm creating a new plan for them as we talk through these different treatments, and as they agree to take one of these treatments, I check the box, and that lowers the My Plan, so that at the end of the visit, we print this out from our practice, and the patient takes it home, and it actually has a material effect on several things. One, of course, the patient's understanding of their risk and the necessity to take medications, and that's translated into patients having increased compliance with their medicines. In a Kaiser Permanente study in Hawaii, they demonstrated that patients took their medications 38% more often after the use of this tool. So this is a very important tool to help you both meet meaningful use and actually make a difference in the health of your patients by educating them. We also, as I mentioned, have an iPhone app, browser-based app that can be used on any smartphone to help patients assess their own risk. And at the end of the risk assessment, patients can click on this button over here and find doctors and hospitals nearby who can continue their screening by doing cholesterol tests and blood pressure, really to help patients in the community who aren't even thinking about their risks assess their risk and get directed into primary care or hospital settings so that they can get their care under control and their risks under control. So the first thing I would mention here is some tools to address care opportunities, and the first of those is a tool that we call Doc to Doc that does care transition management. You may know care transitions are really a hot topic these days, and the care transitions are a big focus in Meaningful Use Stage 2, and that a certain percentage of care transitions have to be made electronically now. But more importantly than that, every provider is going to have to track that all care transitions they make, all referrals they make, actually result in a closed loop. That is, that the patient got seen on the other end, and that the note or the content of that visit were returned back to the sending provider. And that closed loop has been very difficult to track in the past, and here's why. We actually studied this. We went into many practices and discovered that either patients were being told to get their own visit, that is, contact the specialist themselves, or there was some mishmash of phone calls and faxes going back and forth. We found it was understaffed. practices were 3,000 referrals behind. That is, they hadn't even made the first call, and there were stacks of paper sitting on the desks all around. And that may be familiar in your practice, but it certainly was in our practices that paperwork would be faxed somewhere, and then the only way to know what had happened to it was to get on the phone and call that practice, and that wasted an enormous amount of staff time. If your solution to being able to track closed loops for meaningful use is going to be that your staff are going to have to be on the phone, then you really should consider using some of these MyHealth tools to do that, because in the MyHealth system, a black box was addressed and put into an electronic environment. And when we studied it, we showed that each of these circles is a different status of the referral. We showed that there really was no concrete workflow, and that members were spending as much as an hour or more trying to get referrals made and loops closed. And this was really unacceptable, particularly in a sending provider's practice where there's really no financial advantage or benefit to having made these closed loops occur. In fact, it just becomes a different workload on the practice. So we wanted to facilitate that, and when we measured what was going on in those practices, it turns out that 60% of the time, even from referrals made 12 months ago, the referrals remained unclosed, and that's really going to be unacceptable under this new round of measurement for meaningful use. So the care transition process that we established in Doc to Doc is to quarter entry for care transitions, such that both parties know at every point in time what the status of the patient referral is, where the patient is in space, and everything is logged and tracked. And the effect of the tool has been to go from here with 6% unclosed loops down to less than 20% unclosed referral loops. So this has been a tremendous impact on the workflow in the clinic and improving or reducing the amount of time that the clerks have to spend managing these referrals, freeing them up to do work in your practice. And we also have added to that environment the ability for two providers to consult electronically with one another, and some payers actually pay for this activity. It's almost a telemedicine triage, and when the specialist or the receiving provider determines that the patient needs to be seen, then the patient can travel. But particularly for those of you who practice in rural areas, you know the hardship it creates on your patients to have to bundle them up and send them off to Tulsa or Oklahoma City or Lawton or somewhere for specialty care, especially when you could have had a conversation with that specialist that could have kept them in your practice, kept them in their hometown, so that you could manage care from there. And so that's what we've been able to accomplish with these shared care plans. For example, here's a dermatology case, and the dermatologist was able to view the case at the bottom of the screen and within 10 hours give a response back to this sending primary care provider to say, I really need to see this, here's what I think it is. If it worsens, you're welcome to send it to me, but this patient can stay at home and stay in your practice for care, and here's how you can manage it. So the effect of this has been to strengthen the relationship between patients and their providers, their primary care providers, and also it helps to educate me as a primary care provider about what this particular specialist is looking for and needs in referrals. The opposite is also true, wherein sometimes a referral is made, but because it's difficult to communicate urgency, or perhaps I don't have a direct line to the cardiologist, for example, the patient referral may not get the attention and urgency it needs, and so by triaging this case, the ophthalmologist was able to say, oh, whoops, this is an urgent case, and I need to see it sooner. So you can see he was able to set dates of the referral request back to the next couple of days, and also was able to overbook the case so that the patient could be seen in a very timely fashion. The effect of this tool have been to greatly enhance the efficiency of care transitions and also the quality of them so that these providers can meet meaningful use. Now, the last differentiator I would mention is that MyHealth views itself as a strategic partner with you, the provider, and you, the hospital, so that you can actually think about how you're going to move into these new business models in healthcare. It's scary for everybody, but together we are working to help decrease the amount of effort and time it takes a provider to meet meaningful use and to do all the reporting that's required and to coordinate care. And so there's some specific things we've been able to do. We help Medicaid practices that take sooner care patients or sooner care patients in medical homes advance in their tiers by providing these tools. helps you get tier advancement, which increases your payments, your patient-centered medical home payments. We're a partner with Blue Cross Blue Shield and their patient-centered medical home programs as well, which bring additional payments and revenues to the practices. And employer wellness programs have approached us, and we've worked with several of them to direct patients to providers who are MyHealth providers and have these tools in hand. And so the last thing I'll mention here is something called the Comprehensive Primary Care Initiative, which came about in Oklahoma because of the existence of MyHealth and the partnerships that MyHealth helped to establish between payers and providers in our community. And so the Comprehensive Primary Care Initiative was initiated by Medicare, who requested that regions in the United States proposals where multiple insurance plans were willing to work together to provide a patient-centered medical home model of care. And Oklahoma, Blue Cross, Community Care, and Medicaid got together and put in approval for this. And Wisconsin is one of the 7 regions in the U.S. to get this program because they had already been working together in MyHealth to about these models. And so in our region, in this region, you see on the screen, 68 practices were chosen, 265 doctors, and those practices are receiving additional payments for their patient-centered medical home, and they're allowed to share in a shared savings program, which is, we think, better than the accountable care organization because it doesn't have any downside risk to those providers. And what you have now is a situation which is rather than just Medicare coming to the table and saying, practice, we need you to do this, and Blue Cross coming to the table and saying, we need you to do something different, and Community Care saying something different altogether, all of these payers are working together and asking for the same kinds of things, the same patient-centered medical home activities, and they're rewarding with PMPM fees for those practices who do that. What this brought is literally $100 million in new revenue to primary care providers in Oklahoma, and this is a program that we want to help expand and grow with MyHealth providing the analytics services and the point of the healthcare data, the point of care to support these practices. So with that, I'll conclude and just let you know that MyHealth is, yes, we're a health information organization, and yes, we deliver the services that you can earn many months of services just with the voucher you would assign to MyHealth. You get all of these additional clouds of tools around the outside, and we help you position you strategically for this coming challenges in the healthcare marketplace. So please feel free to contact us with any questions, and I believe we'll go to the question section after this.